Hi, this is Dr. Bob Dannenhoffer. I'm the Douglas County Public Health Officer, and this is another in our series of Facebook Live sessions. We had one last Friday, and it went great. We got some very nice comments, and thank you for being gentle, because I'm sure I wasn't as good as you thought. You may notice a change in the interval. I'm new, clean shaven. This will allow me to use a special N95 mask to help protect against aerosol from the coronavirus. Hopefully I won't need to use it, but if we do, I'm ready to go. So we got some calls over the calls and letters over the weekend. And so I have some questions here. If people have new questions, please add them on the comment section. And Kristen and Vanessa here will get them for me and we'll get them. So here were two questions we had over the weekend. So someone said, well, you tell us not to panic. Could you give us some specifics? And I would agree that generally the idea of, oh, just not panic is not very helpful advice. So I came up with some specifics. So the first specific is avoid going out and buying stuff you don't need. So there's been a run on toilet paper and water. I can't really understand that. I don't think no matter what happens, we're going to be short of water or short of toilet paper. So don't go out and buy it, because when you go out and panic buy anything, it encourages us to think, well, maybe there's going to be a shortage, I should buy it. So I think if I went to the grocery store today and bought lots of salt, people would say, oh my God, there must be a salt shortage. And there will not be a salt shortage, but we could sort of make one happen. So the first thing to do in panic is buy what you need, but don't buy more in panic buying. The second one is try not to spread rumors. So rumors are really hard in this time. There's sort of not enough information anyway. And when people start rumors about, oh, there's a case in this school or there's a case in the hospital, try and see if you can get the right information first. Our COVID-19 hotline is open every day. And those people there have the access to the information about where cases are or aren't. And so we want to try really hard to help quell rumors. The third thing that we would have you do is try not to be too critical of the people who are running this pandemic. For all of us, it's our first pandemic, and we're doing the best job we can. And I know that we certainly haven't done everything right, but sometimes we can get into the habit of criticizing everything that happens and not focusing on the things that we can do. The second would be to try to be nice to other people. And we have some great stories that we'll share later about some of the nice things that people have done in our community. And the last is to be really nice to yourself. So when we panic, we tend to focus inwardly, and we sometimes are a little selfish. So this is a time to just relax as best you can, enjoy yourself, get some exercise. People may start to feel a little bit housebound if they're stuck at home and away from work, but there's absolutely nothing wrong for going for a walk, going for a bike ride, or working in the garden. So get out, do some things, and I think those are things. So rather than just saying don't panic, try those 5 things. Another question we had was somebody was at a clinic this weekend, and they saw a lot of people wearing masks, and they were a little confused because we've said in general, we're not encouraging people in the general population to wear masks, and that's indeed correct. But in a medical setting, it's a little bit different. So in a medical setting where you may be around people who are coughing, most clinics are asking the patient to wear a mask and then the provider to wear a mask. So, however, though, even if they're not seeing a patient with a cough, a lot of times the provider will just leave the mask on all day. And the reason they do that is taking it on and putting it on and taking it off is the time actually is the most dangerous time of wearing a mask. So in some places, they're keeping the mask on all day. And by keeping it on all day, they don't have to don and doff. So I was at a lab this morning talking about something else, and the person who was around patients was wearing a mask the whole day. That's totally acceptable and doesn't fly in the face of the other recommendations we'd had. So somebody asked for a general update. Let me give you a general update. Well, things have changed a lot. So a week ago, there were no closures. Everybody was still going to baseball games, basketball games, and March Madness was on. And really in the space of just 5 days, we've had a dramatic change in our understanding of what's going on. So whereas 5 days ago, Blazers game was good, now we're talking about really limiting the amount of contact that people have. And each day it changes. So just this afternoon, the president came out with a recommendation that we avoid groups of greater than 10 or any congregation of vulnerable people. The CDC has recommended for 8 weeks at least to avoid groups of more than 50. Throughout the world, there's been a rapid spread of this virus, especially in Italy and Iran and now in other places in Europe. The United States has also seen somewhat of a quick rise. and Oregon is right along with that. We had our first death over the weekend, an older man who was living at the Veterans Home up in Lebanon. Still in Douglas County, we just have that one case. That one case was a presumed case. I think the CDC is saying now, if the state lab did it, the state labs are so good that they're considering that a case. So we just have a single case in Douglas County. We continue to send out specimens for people who are hospitalized and are sick, and all of those have since been negative. So we're doing okay there. The people in Douglas, the healthcare leaders in Douglas County have been meeting on a regular basis. We had our 14th twice weekly meeting this morning. And so really we get incredible involvement from the county, from EMS, from schools, from emergency management, from the hospitals, each of the big clinics, and Douglas Public Health Network. So while nobody's had a perfect response, we've really had a pretty amazing response by everybody in the community coming together. Okay, so we've got a few more questions here. All right. So Dennis says, we're confused. First, we were told it's like a cold. Now daily reports say it's like a death sentence. What's going on here? And I can see why people are confused, because this is a confusing virus. So most viruses have sort of a clinical picture that's about the same for everybody who gets it. So if I'm an old pediatrician, so I remember measles and chickenpox. And while we had sort of mild and severe cases of chickenpox, the difference between the mild and severe cases was not that much. In this disease, it's one of the funny diseases in that if we take 100 people who are infected, and we know this well from the people who were on that Diamond Princess cruise ship. So they were on the cruise ship, they tested everybody several times. And so we pretty much know that in the 3,700 people on the cruise ship, about 700 got infected. So that's a pretty high attack rate of about 15%. We know that of the 700 that got infected, about 40% had no symptoms at all. So they didn't even know they had an infection. About 40 out of 40% had a mild infection, like a little upper respiratory infection and a cough. Certainly nothing that if they were home, they might even have sought care for. About 20 out of 100 were sick enough that they probably would have been hospitalized. And about 5 out of 100 were sick enough to require ICU care. About half that required ICU care died. So what you see here is that, yeah, it goes to everything. So that people say it's going to be a mild cold. Well, for some people it will be. For some people it's a death sentence. Unfortunately, for some people it will be. So one virus to have this wide range of clinical patterns is really quite unusual. And that's why this is going to be hard to treat and hard to detect, because 80% of the people are really not even sick enough to go to the doctor, and yet they can continue to spread the disease. So that's a good question, and I will tell you, it is confusing to everyone who does this. So a question here is, Sue asks, if somebody is suspected of having COVID-19, how long after symptoms improve is the person contagious? This is a hard one to know, because people can sometimes carry the virus in their nose for a while, but we think people are contagious until 3 days after their symptoms have resolved, or if they're hospitalized, 7 days after they're hospitalized. In some cases, they're doing repeat swabs, but we're not sure that that's particularly accurate. So 3 days after your symptoms resolve, or 7 days after you get discharged from the hospital, which is ever is longer. Now, there are a couple of people that I've talked with who've had the disease, and they say 4 or 5 weeks later, they're feeling better, but boy, they still have a terrible cough. So that may be a long time that you're home. Diane asks, when are we getting testing? And the answer is, I hope really darn soon. The commercial labs are coming up, and I think we're coming up with a strategy, and I hope by the next time we talk, we have fabulous news for you. The question is, why did Douglas County declare a state of emergency? And is there a case that's being kept from the public in the VA hospital? So all of the cases we know about in Douglas County, we know about. There's one presumptive case. We are not hiding any cases at the VA hospital. The question is, why did the county declare a state of emergency? Well, states of emergency help in a couple of ways. One of the ways is it helps to relax rules. So, for example, the hospital has rules on staffing, which can be waived during a time of emergency. So having that emergency can sometimes help. It can also help businesses who may suffer losses due to an emergency to get reimbursed for those losses. So that's why we did it. So what is the relative danger of getting COVID-19 from fomites compared to vectors? So this is an epidemiologist in the making here. So fomites, those little things that you might come in contact with, vectors would be like bugs or things like that. I think the danger here for non-epidemiologists is that somebody coughs and sneezes sitting next to you at the bar, a family member is sick and you care for them. That is, at least from the Chinese data and the Korean data, far and away the most likely thing this spreads. We're trying to have people wash their hands and clean the doorknobs, but I think in public health, we think it's far more likely that you get this from droplet spray or coughing than from the doorknob, but you still take care of it. So this is a question: if someone gets this virus, is it a one and done, get it once and then you're immune, or could you get it multiple times? So there are lots of different viruses out there. For most viruses, it's a one and done. So most people, if they got the measles back in the days when I got the measles, it was rare to get it again. Some other diseases, a little bit less. So we know people have had chickenpox more than once. And we know something, for example, a norovirus, you can clearly get that more than once. And so with some viruses, you build good immunity, never get it again. Other viruses, touch and go. This one we don't know. There are a couple anecdotal cases of people who appear to have it twice, but those seem to be really the rare cases. It seems for most people it is one and done. But, as we're later on in this, we'll know a little bit better. So what about motel workers and gas station workers? Well, Evelyn asked this question. So motel workers, gas station workers, they are at some risk. Presumably if you are a motel worker, you're going to be cleaning up the stuff in the motel. However, again, we don't think that the risk of cleaning bathrooms or whatever is tremendously high. Again, if there's aerosolization, it's a little bit higher. But for just cleaning, I think the usual things we do should work. We think bleach solutions work very well against this, so you can use it. Gas station workers, again, you're going to have some contact when you talk to the person and some contact when you pump, but that's relatively small contact, and it's perfectly fine to, have them stand back a little bit from the car so they have to reach out and give you this so you don't get close to their mouth, which is where we think most of the germs come from. So I had a question over the weekend, what about immunocompromised people? So when the Chinese looked at the data, people with conditions, chronic conditions, were far more likely to die than people who did not have chronic conditions. In China, there's much less immunosuppression than goes on here. So in our country, there are a lot of autoimmune diseases, and we use these immune modulating drugs. That is not very common in China, so they did not have a specific category for immunocompromised people. However, looking at all the data, I would think that immunocompromised people at any age are at an increased risk. But it appears that the biggest risk factor, again and again in all the studies, appears to be age. Again, no deaths in people less than 10, 2 in 1,000 deaths for people up to the age of 30, about 5 in 1,000 deaths when you get to be in the 60s, and about 5 in 100 when you get to be your 60s, and about 15 in 100 when you get to your 80s. That's a high death rate. So again, that's why most of the work has been about trying to protect old people from getting this. And that's why there's such concern with the outbreak in the nursing home in Kirkland, Washington, and then the outbreak here in the veterans home in Lebanon. So how much long-term damage is done to the lungs for those that get this virus? So again, this virus is only a few months old, so we don't know. Most of the people in China who got this and recovered. What happens to their long-term lung function is totally unknown, but most of the people who got this, at least anecdotally, by the time they get done, cough, but otherwise feel well and are probably not going to have long-term lung damage. But again, that totally remains to be seen. Mia asked is it true you'll only be tested if you've been traveling around someone who has it? So the current guidelines that the state lab is using is that the only people being tested is people who've been around a known contact and now have symptoms, people who travel to one of the 5 countries and now have symptoms. Now, I will tell you that 5 countries is really out of date, because at the time they did the 5 countries, Italy and Iran and China and South Korea, those were the only countries had it. Now, every country has at least as many cases as those countries had, when we put those in. So traveling doesn't seem to be a good predictor. The other time the state lab is doing the testing is somebody is sick enough to be hospitalized. But again, commercial labs are coming up. I talked with Quest Labs today. They're doing 10,000 tests a day. And so it really looks like within the next couple of days, we're going to be able to get a testing solution. Now, the testing is going to help a little bit because we'll know who has it. It does not change what you would do. So if I was coughing but not very sick and I was positive, I would basically be told to stay home and see if you're worse. If I was negative, I'd be told stay home and we'll see if you're worse. So it doesn't really change what happens since there isn't a specific medication. But again, I think testing is clearly the key to getting this under control. And I think we'll have some of that within the next week or so. So swine flu was worse. Well, Patty S says swine flu was worse and we didn't react this way. Please comment. Swine flu was not worse. Swine flu was not this contagious. Swine flu was not this deadly, especially for seniors. So swine flu was an issue. Swine flu spread moderately quickly, but in the end killed very few people, only a few in 1,000. Certainly not the 150 in 1,000 that this is going to kill. Now, if you looked at the state data or the national data and said, well, there's not so many deaths so far. It's true. But if you look at the doubling rate, how fast this doubles, this is doubling really quickly. The state predicted 6.6 days. It looks about 5, it's doubling every 5 days. When we looked at the flu, it took 3 weeks to double. So this is going much faster and is much more deadly than the swine flu. So swine flu was bad, no doubt about it. And, we did a lot of work on swine flu, but it was not nearly as bad as this. So Taylor asks, we heard this is expected to last well into the summer. Is this correct? Well, we're epidemiology nerds, and just like people don't know the future, we try and predict. And a couple of the ways to predict is to see what happened in other countries. So in China, this started in December, and they didn't really get it under control until February. So that was 3 months. Korea, it started about early February, and by mid-March, they kind of have it under control. So they were 4 to 6 weeks. Singapore never got out of control, and so they controlled it right off. However, Italy looks like it's going to be at least 3 or 4 months. And so Italy is maybe the most analogous country to us. So it could easily last into the summer. I think the CDC hinted at that today when they recommended that gatherings of 50 or more not be held for 8 weeks. So I think it's certainly going to last more than 2 weeks. You really have to have testing up for a month or so before you do it. And as I said before, testing is not quite up yet. So it's going to, I would predict this is going to last into the summer. So how much does social distancing actually help? Actually, a lot. So when we look at the contagiousness of this virus, you have to sort of, to give you an analogy, imagine I gave you a magic marker, and everybody you could touch, you were able to make a black marker on their face, and they were infected, and then they got a magic marker, and they could do to the next guy as much, and then you could do that. You could imagine at a Blazers game, by the time you left, everybody would have black marks on their face. Whereas if you stayed home and watched the Blazers on TV or watched something else on TV, and you were just with your family, the two of you would have black marks, but that would be it. And so we think spread of disease is very much like that. And so the more contacts you have, the more likely to have it. Now, the question is, well, what's the difference between 3 feet, 5 feet, 6 feet, 7 feet? You had to pick some answer. And so people have picked 6 feet. One of the things that we're in a studio now with lots of side lighting, and I didn't think I usually spit very much when I talk, but I've noticed a couple of little spitballs come out here, and they all have landed right on the other side of the table, which is about 3 feet away. So that kind of proves what's going on here. And actually, if you do this sometime, you'll see that everybody does that when they talk, and they usually land about 3 feet away. So I see Brian moving back here, as he should. Okay, next question is, can you touch on the risk of aerosols again in regards to dental treatments and concerns there? So dental treatment is a worry. So Justin asked this question, and he's right. if you've been to the dental offices, you realize these things are rotating at hundreds of thousands of times a second. So I mean, these things are incredibly high speed, and that's why dental drilling is so much less painful than it used to be when they did things that were rotating at thousands of revolutions. So you do get aerosols. The dentists do an incredibly good job of protecting themselves. They use ASTM level 3 masks. They use face shields. They use gloves and gowns. So even if they would take care of a person who did have COVID, we think they would have adequate protection. So again, dental treatment is a concern. There was a discussion today that maybe dentists would curtail treatment to help save masks and gloves. I do not know where that's going to wind up. So the question is, how would we know if we've been in contact with a person here in town? And the way we know, and Mary asked that question, the way you would know that is we did this interview of the person who was the thing. We went over their contacts, and if you were a contact, we called you. So if we haven't called you, you weren't in contact. Now, could you have been perhaps in the same parking lot? Maybe, but again, that's not a risky thing. The risky thing is prolonged direct contact, like you would have at somebody that you shared a dinner with, that you sat next to in a car, and we've done that. So this is Ryan asked this question, for those with mild symptoms who are staying home, should their family be quarantined as well? The answer is no. If you're not a confirmed case. If you are a confirmed case, then maybe. But if you're not a confirmed case, you should stay home. And then your family should look carefully. If they start to get sick, then obviously they should stay home. And again, remember, the quarantine is 14 days. The average incubation period is 5.2 days. So if you stay home for 14 days and your kids or your other family members are getting it, they'll usually get it by the time you're done. And then they too should be quarantined. And that's exactly how Korea took care of this. So what they did is they found all the people that had it, they quarantined them. They had their, with their family, they looked at the family, and if they got sick, then their family did it. Now, if your family can stay home with you, that's great. You can all stay home together and do things. Although the person who's quarantined should be in a separate room, not exposed to the rest of the family. So Ashley asks, has the person who was positive here improved? So we like to speak in general terms. The answer is yes. Can your pets get it? This is a tough question. So coronavirus is a virus that spreads in lots of animals. And so what we think is that dogs and cats do get kind of coronaviruses, but not this one. But that with all coronaviruses, there may be cats and dogs who have it in their stool or somewhere, but doesn't cause any troubles. And since we tend not to have lots of contact with our dogs' stools, probably not a source. The other countries that had this did not have large pet dog and cat populations. So we don't really know this answer. So both in China and Korea, cats and dogs are a little less common than they are here. So Kelly asked, do you foresee the need for our school closures to last longer than 2 weeks? And again, I answered this the last time, and I think what we're going to do is we're going to reevaluate during spring break, and we'll see. If the number of infections is continuing to rise or has not significantly fallen, I think the school closure could be longer. Some places have canceled for the rest of the year. I think we're looking at this on a week-by-week basis. So is it safe to give out food at schools while they're closed? Patty asked this question. Yeah, that's a great thing. There are a bunch of kids in the community. Their only hot meal of the day or their only good meal of the day is at the school. So some of the schools are now giving out meals, and I think that's a good thing. So this is a great time to talk about some of the great things in town. So in a time when we've seen some maybe a little bit bad behavior, we've got some great stuff. So this person in the community, I don't know if she's given us to give her name. So she said, I offered to do shopping and pick up medications and deliver them to members in the community. I offered to set the items on their porch so that there's no contact. Maybe others could offer to help. Just a thought. And that's a great thought. And we have a website. Now, we use this website during the Snowmageddon, and it worked pretty well, but not a lot of people knew about it. We're hoping now more people will use it. It's called resource.org. Did I get that right? So resource.org, you don't have to log in. And if you go and put in Roseburg, Oregon as the site, you can either say, I need something, or you can say, I got something you want to donate, or some way you want to volunteer. And we're working with Kristen Rutledge, who's at the Public Health Network, who's doing this with the COAD, which is a group of community volunteers who are there to help out. So this is a great thing. So if you're there and you're housebound, need somebody to do shopping, need somebody to pick something up, or if you've got some time and could do that, this is a great place for you to match. So, eBay is, I got something to sell and you want to buy it. This is, I need something and can you do it? So this is a great thing that we've seen in the community. So the question is, what about our kids home from school? Should we limit or deny access to their friends? And Chris asked this question. Well, again, remember the magic marker thing. If you have 31 kids over on the trampoline, there's going to be a lot of black marks because they're going to get home and give it to their family. On the other hand, if your kid has a best friend and they're going to be together during this time, it increases the exposures a little bit, but not that much. And so you do need to make a judgment of what goes on. Now, if friends are sick or your kids are sick, please don't mingle. If everybody's well, probably okay. So Lori and others have asked, how many ventilators and hospital beds are there in Douglas County? And the story is, we have plenty of hospital beds and plenty of ventilators for regular times. But depending upon how this gets, no place in the world will have enough beds and ventilators if it gets really bad. And that's why we're trying to sort of what's called flatten the curve. So instead of everybody getting sick in the same month, if we can go ahead and reduce the number of people who get sick in the first month, and even if it lingers out a little bit longer, we won't get overwhelmed. So there are about 6,000 ventilators 6,800 ventilators in the state. We have about 4% of the population and about our share. But there are other things that people can use for ventilators. Those, if you've ever had anesthesia, anything, those can be ventilators. There are a lot of people in town who have CPAP and BiPAP machines in a pinch. They can be used for non-invasive ventilation. I think when we talk around, the big thing is not going to be the number of ventilators. It's going to be the number of people who know how to use ventilators. And since it's not something you can pick up in an hour, that may be the limiting factor. So if you have to, the governor had a press conference today. At the end, really a very brilliant person from OHUCU talked about that, and she talked about it much better than I ever could. So if you'll go on the state website, on the YouTube video for the governor's conference today, and look at the whole thing, but especially the last 10 minutes, you'll know. So what's being done about the homeless? So this is a tough one because the homeless are at some greater risk for this. They do tend to congregate. The homeless don't have great hand washing facilities, and they don't have like a phone to call the hotline and the other kind of things along the way. So we do really, really, really do worry about our homeless population. There are people in the community that are working to get hand washing stations for them, so at least they can do some hand washing, because our recommendation is frequent and thorough hand washing. And if you don't have any place to wash your hands, it's really hard to do it. So there are groups working in town. Again, if there are people who'd like to help out, that resource.org is a great place to do it. The other place to work out, to help out, is on our hotline. So let me spend a few minutes on the hotline. So we start that up Friday afternoon. We went all day Friday. We did Saturday, Sunday, and today. We had incredibly great support from people in the community, especially the people at Aviva at Evergreen. They really did a great job with this. I think we've taken over 100 calls. The calls were great. Some people were just nervous and wanted to talk. Some people had other things, and we still could use information, so we could use help. So if there are people out there who wouldn't mind answering a phone, you don't have to be a genius about COVID. You just have to answer the phone. So we could use phone screeners. If there are doctors or nurses out there who are maybe quarantined themselves, or doctors or nurses out there who would be willing to help out and do a shift, the screeners we would like to have in person at our building on Madrone, but the doctors and nurses can do this remotely. And this would be a great opportunity to give back. It's fairly light duty, and I did it Saturday. It was a hoot. So the question is, how high a fever should you have before you worry? And Misty asked this question. It turns out that this disease and fever is not like other diseases. So like with measles, the fever is so high and so ferocious. Typically, when the first or second day is 105, or I've even seen 106 with the measles. So you can have an absolutely ferocious fever with the measles, and an absolutely ferocious fever with the flu. This one is weird because in a number of cases, on the first few days that people are sick, fever is like, well, I felt warm, but I haven't really taken a temperature. We got low-grade temperature. So I think our recommendations for fever have not changed. Fever in a baby, obviously worrisome. Fever and some other symptoms, worrisome. The fever for this is not necessarily the cardinal sign. The cardinal sign on this is a deep and hacking cough associated with muscle aches like you got run over. So how safe is it to have newborns right now? Well, I don't think you get a chance. I don't think you have a choice. I think something happened 9 months ago. It'll tell you have newborns now. The good news is that newborns do not seem to be at risk for the disease. There's 0 deaths among newborns who've gotten this disease. And we know some newborns have gotten it because we know their moms had it, and the moms had it when they delivered, and the babies had it when they were born, and still no deaths. So it's much safer to be a newborn than a 60-year-old. So Lori asks, is Douglas County making plans in case this becomes pandemic and our medical facilities are overwhelmed? So as I said, the community leaders have been meeting. We've had our 17th meeting today. And when we meet, we have 3 goals in mind. The first is how do we prevent our hospital from being overwhelmed? The second is how do we protect our staff from being infected so that they can staff the places where we need to do it. So it's how do we do that? So we have plans. The hospital made some plans today to go ahead and decrease the amount of elective procedures, elective surgery, so as both to save equipment and to give extra room. Again, remember, there's no one in the hospital now who has this. So it's not like right now, but the fear is that if we would have 10, 20, or 30 cases, it could overwhelm the hospital. The hospital is working on a daily basis to figure out strategies on how to deal with this. And if there's any place in the state that's well prepared to do it, it's Douglas County and Mercy Medical Center. So, yeah. So Laura asks, the CDC and state have different guidelines for groups. Why can't we all get on the same page? I don't know. I mean, the story is, I don't know. And this is a time, remember I said, don't panic. One is be gentle with the people who are doing this. This is our first pandemic. Yeah, I'd really love to see the CDC and the states be on the same page. But I think you've seen throughout this whole thing that different people are on clearly different pages, right? So there's a time when people say, oh, don't worry, it'll blow over. At the same time, others are very worried, and then some people get worried and others less worried. I think in general, the advice may be slightly disparate, but it's about the same. So right now, so the CDC had no limits on gatherings a week ago, 50 for 8 weeks last night and 10 today. So they've changed very quickly. Oregon had 250 last week, and then today is going with the CDC guidelines. So, it changes very quickly. I mean, I'll tell you, a week ago, so when we did this last Monday, we said there's no limits on gatherings. So this has changed very quickly. And some of the not being on the same page is that. What we try to do is distill it down. This is not the time to have a party of 300 people. This is a time to go ahead and limit gatherings, especially for vulnerable people. Yeah, so Jan asks, if I have a family member returning home from out of state, should I quarantine myself or them? If so, for how long? So a family that's a friend of mine asked me the same question. Their child was coming back from college, and the question is, what should they do? Should they quarantine themselves if they come back? Well, coming from out of state is not really higher risk than just being in state, because we think this is in all states. Now, if you come from a state where there's a lot of spread, like Northern California or Seattle, you may want to have them quarantine themselves for a while. This person was coming from the Midwest, which has a very low case count, actually lower than Oregon, so there were no special recommendations for quarantine. But again, this is a time to be cautious about flying. This is a time to be cautious about being in big groups, because this is where you could pick it up. So I'm sorry. This is the website is recovers.org, recovers.org, and Kristen will put that on the comment section so you'll get it right. When it comes to things like that, I'm not that trustworthy. Okay, so we got so many questions. The last time they were just flying in so fast that we didn't really get a chance to answer all the questions. So if you got the question, call the hotline. And if they don't know the answer, they'll look it up from an authoritative source, or they'll leave it for me the next morning, and I will get you the answer. So we'll do it. So let me give you the numbers again. The numbers for the website are Douglas Public Health Network, all one big long word, .org. The hotline, 541-464-6550, and Facebook on Douglas Public Health Network, you can get it, or DPHN, So you can just do the 4 initials, or you can write out Douglas Public Health Network and you get Facebook. And that's sort of the questions have slowed down a little bit. So we'll do this again. Who knows how much it'll change before then. Just we'll end with a funny story. So during times of panic, there are little things that just bring smiles to your face. There are 3 things I'd point out to you. One is you notice the new sleek look. Actually, the CDC came up with the beard formations that were acceptable to have with an N95 mask and those that were not. So they've got this. So if you look at CDC beards, and we'll put a link to it on the thing, it's just a hilarious thing of all the different names for the beards. I didn't realize that every beard and mustache combination had a special name. So a friend has got a beard here and a soul patch, and a mustache and a soul patch together is called the Zappa. So he has the Zappa, and he knew it. And so all of these. So I went from full beard, and it had a German name, to paintbrush. So that's where I am now. So that's funny. The other one is the Vietnamese hand washing song, which is a hoot. And then a local story is that this family was driving around today, and everybody was honking at them. Why were people honking at me? And so when they finally got out of the truck, the dad noticed that the daughter had put on the back of the truck, "Honk if you're happy." And so during this time, be gentle with each other, be gentle with yourselves, and try to be happy as you can. Again, this is Dr. Bob Dannenhoffer, Facebook Live. Join us again next time.